Most of the people, not all, but most of the clients that I have in my practice are really historically marginalized community members, historically oppressed community members. Many of them are Latinx community members, and so historically speaking, we have internalized in some ways that when things are not going well in the world or around us, there's a way that the world has a way of sort of making it feel like there's a deficit in us, that we lack something, that there's something insufficient with us in not being able to respond better or in more sort of more appropriate ways to the situation. We've internalized some of those historical messages and ideologies. And so part of what I do with a lot of folks is I try to help contextualize and separate out what the reality is in the context in which we live and exist, which is, I feel like a lot of times people are having healthy responses to unhealthy situations, and yet they are made to feel like their responses are the things that are sort of not okay and unhealthy, if you will. And I think really differentiating those processes and helping people not take on and carry the entire burden and load of what they might be experiencing and internalizing, and separating out, okay, what's theirs and what do they have control over and what can they do something with, and then what's everything else out there that we can't control, that's unhealthy, that is not something that we should accept as ours, and yet trying to sort of find a rhythm somewhere in that. I think we move from despair to being okay. I think we have to separate out and differentiate between feeling hopeless and also from feeling helpless. I think feeling hopeless in these moments, given what we're experiencing now, can be a very normal experience, but how can I help transform the feelings of helplessness that can come with hopelessness to help the person do something differently as they're moving forward? And then thinking about it, again, from a liberatory perspective, it's like, how do we take care of each other during this time? And I think there's it's really interesting because there's been a lot of research. I don't know if it's a lot of research, but some research that's talked a lot about how historically marginalized communities in times of crisis are thriving in many ways. So as much as many of the community members that I work with are struggling and really in survival mode, we also are resilient, and we also are accustomed to really enduring and moving through very difficult situations, and have for generations, in many ways. And so there's also something inherent about who we are as, for example, Latinx community members, who are primarily the folks that I work with. There's something inherent around our legacy of surviving, of thriving in the midst of chaos and crisis. And so part of when I talk about decolonizing, it's also part of reconnecting people with those historical ancestral values and processes that I think in many ways have been lost and have been forgotten. I may not always talk about it as like ancestral or historical, depending on the client, but what I may do sometimes is I may think about like even their own historical family processes in history, and so really trying to contextualize their circumstances and situations within even their own immediate family members and family culture, and what that looks like. And so there may be traumas in there, and in spite of those traumas, the fact that I think the individual sits before me in the office at that moment in time, whether they've experienced the trauma themselves or whether the trauma is intergenerational, historical trauma that they've experienced vicariously or through secondhand information and knowledge, they're sitting before me, and their families have moved through and endured many of those challenges in some ways. And so, what is there to be learned and gained from understanding those processes? What is there to be learned and gained that the individual can use at this moment in time as a way to provide them with a sense of persistence, patience, and persistence, and not necessarily with accepting that the situation is okay, but accepting the situation for where we are and what it is, and thinking about what they can do to change the outcome of the situation in a way that's more consistent with what they want their life to look like. I also think a lot about exceptions. I look for the exceptions in these circumstances and scenarios and situations. So I may ask someone, when was the last time you felt a sense of despair or hopelessness, maybe, or helplessness, and were able to move through it? What did that look like? What was different about that situation? What can we learn from those moments in time to help build at this moment in time and move forward? I think what happens a lot of times is people become so inundated with what's right before them, and the feeling so overwhelmed with the situation that they have a short-term memory, that they forget about some of the things that they have done before, and some of the skills that they have, internal resources, et cetera, that they have before, that they can use. And so sometimes it's just a matter of really just revisiting and understanding how to continue to use those types of internal resources and skill sets to deal with the situation at hand.